Good afternoon, and thank you once again for joining us. I'll start with the usual update on today's statistics. The total number of positive cases reported yesterday was 744. That represents 4.2% of the total number of tests and takes the total number of confirmed cases in Scotland to 110,040. 172 of today's new cases were in Greater Glasgow and Clyde, 158 in Lothian and 94 in Grampian. The remaining cases were spread across the 8 other mainland health boards. I can also confirm that 1,032 people are currently in hospital. That is an increase of 20 from yesterday. 50 people are in intensive care, which is the same as yesterday. And sadly, I also have to report 36 additional deaths have been registered in the last 24 hours of a patient who first tested positive for coronavirus over the previous 28 days. That takes the total number of deaths under that daily measurement to 4,239. Each one of those deaths has been a source of heartbreak. And so once again, I send my condolences to all those who have lost a loved one to this terrible virus. I'm joined today by our National Clinical Director, Professor Jason Leitch. Jason has a few words to say shortly after me and then will be helping me answer the journalist questions. Before that, there are a few issues I want to update you on. The first concerns international travel. The Scottish Government last night announced the latest changes to the list of countries which are exempt from Scotland's quarantine requirements. We've decided to remove 3 places from the list. Those are Namibia, Uruguay and the US Virgin Islands. That means that from 4 a.m. tomorrow, people travelling to Scotland from these locations must self-isolate for 10 days upon their return. These changes represent the last formal review of the exemption list this year. The next review will take place in the week commencing the 4th of January. In the meantime, the UK Joint Biosecurity Centre will continue to monitor the relevant data, and we will, of course, take action before the next review date, should that be required. And, of course, the Scottish Government's general advice remains the same. You should avoid any unnecessary overseas travel right now. My second update relates to an important measure that we put in place at the start of the pandemic in March. At that time, we took steps to suspend car parking charges at 3 hospitals, the Edinburgh Royal Infirmary, Glasgow Royal Infirmary and Ninewells Hospital in Dundee. In all 3 of these hospitals, the car parks are privately owned as a consequence of PFI funding. And so they were the only hospitals in Scotland where car parking charges still applied. Today, I can confirm that we've reached a further agreement with the private operators of these car parks, and as a result, the suspension of parking charges will be extended at all 3 hospitals until March 2021. Continued free parking is obviously good news for patients and visitors at these hospitals, but I know it will also make a huge difference to hospital staff. Our NHS workers have done an extraordinary job for all of us throughout this pandemic, and they still do. So it is only right that we make life a little easier for them as they carry out that vital work. The third issue I want to update you on today is the expansion of our testing capacity. This week saw the opening of 2 additional walk-through testing centres. One of those opened in Kilmarnock on Wednesday and the other opened yesterday in Oban. These 2 new centres add to the 20 others that we've established across the country and mean that we've now met our target of having 22 walk-through centres in place for the winter period. I want to express my sincere thanks to everyone who has helped to make that possible and to thank all those who are helping to operate the different sites. All of the centres are open to members of the public, and you can book a test by going onto the NHS Inform website. You can do that if you are in a profession which has agreed access to testing, and of course, you should book a test immediately if you have COVID symptoms or if you're advised to do so by Test and Protect. The walk-through centres help to make testing as accessible as possible to as many people as possible. So we'll continue to work with the UK Government and our local partners to deliver more of them over the coming weeks. Of course, as we expand the accessibility of testing, we're also extending NHS Scotland's laboratory processing capacity for tests. On Tuesday, the first of 3 new NHS Scotland regional hubs for processing tests opened at Gartnavel in Glasgow, and the second hub opens today at Forester Hill in Aberdeen. They will increase Scotland's testing capacity from around 12,000 tests a day to almost 30,000 tests a day by the end of this month. And when fully completed, with the regional hub to be established in the east and opened in January, that will take our daily testing capacity, including our share of the UK-wide Lighthouse programme, to 65,000 tests per day. The final point I want to make is about Christmas, which is now just a week away. I know that many of you will be finalising your plans, so I want to quickly remind you of some of the key elements of the Scottish Government's advice. Essentially, the 5-day period over Christmas from the 23rd to the 27th of December is a limited window of flexibility. It's not a period of time when we think it is safe for people to meet. So let me emphasise that any interaction you do have with another household should, if at all possible, be outdoors. If you do consider it's essential to meet indoors, it's better to limit gatherings to 2 households, a maximum of 8 people. And the numbers of people gathering in any event should be as small as possible. In addition, please limit the length of time you spend with people. We recommend only meeting other people in your bubble on 1 day over the Christmas period, rather than on 5 days. Avoid overnight stays if you possibly can, and take precautions such as opening a window for ventilation, keeping your distance, washing your hands regularly, and not eating from the same dishes or sharing the same serving spoons or crockery. Finally, avoid travelling if possible, and do not travel to or from Tier 3 areas in England, which have the highest prevalence of the virus. All of these points are set out in our Christmas guidance. However, the central point I want to emphasise is this: staying within your own household and in your own home is the safest way to spend Christmas. The vaccination programme helps us see that, along with all the other measures we need to take, an end to this pandemic is now in sight. But until then, all of us should be doing all we can to keep each other safe. That means following the Christmas guidance over the 5-day period next week, but it also means sticking to the current rules and guidelines. So to close, I want to remind all of us what those are. Remember, if you're in any doubt about the rules in your local authority area, you can find out using the postcode checker on the Scottish Government's website. But if you live in a level 3 area, and from today that includes East Lothian, Aberdeen City and Aberdeenshire, you must not travel outside your own local authority area unless for an essential reason. And people living elsewhere in Scotland must not travel to level 3 areas except for essential purposes. There must be no non-essential travel between Scotland and other parts of the UK. None of us, outside of some island communities, should be visiting each other's homes, except for very specific purposes, such as caring responsibilities. If we do meet people from other households, either outdoors or in public indoor places, the limit is 6 people from a maximum of 2 households. Avoid car sharing if you can, work from home if you can, and download the Protect Scotland app if you're able to. I know all of this is difficult and it's not any easier with each day that passes, but we all know, and you certainly do, just how important it is. And finally, please remember facts, the 5 key rules that we can all use to reduce our chance of getting the virus or of passing it on. Face coverings, avoiding crowded places, cleaning our hands and cleaning hard surfaces, keeping 2 meters distance from people from other households, and self-isolate and get a test immediately if you have any of the symptoms of COVID. These rules are a further way in which we protect ourselves, our loved ones, and our communities, and we safeguard our NHS and our health and care staff. And most of all, they help us save lives. So thank you once again to everyone who is doing all of this. It really is appreciated and it really does matter. Let me hand over now to Professor Leitch, who has a few words he wants to say, and then we'll take the questions from journalists. Thank you.
Thank you, Cabinet Secretary. Today I'd like to give just a brief update on the work that is ongoing to support people with the condition we've come to know in the world as long COVID, or more accurately, post-COVID syndrome. No one, regardless of their age or their previous health status, is free from risk of COVID. Over the past weeks and months, we've been learning about how post-COVID syndrome is affecting people who are suffering from what can at times be a debilitating, longer-lasting illness, and how best to support them within Scotland. The NHS in Scotland is delivering care tailored to the individual needs of people who are experiencing the ongoing effects of COVID-19. This care is being given across different specialties, including rehabilitation, respiratory and cardiac services, often led and managed by our primary care colleagues in general practice. Looking to the future, we recognise that research, rehabilitation and clinical input will all be critical to understanding and supporting those in that long recovery. That is why we've launched a further call for Scottish-led research into this important issue. I'm pleased to confirm that the final funding decisions on the outcome of those research applications will be announced later this month. This work is in addition to the £5 million we've already awarded to 15 Scottish research institutions to help us increase our understanding of the effects and inform treatment and management of this virus. The pattern of this disease is telling us that there will continue to be increases in demand for a range of rehabilitation services. That's why work is underway to implement our framework for supporting people through recovery and rehabilitation during and after the COVID-19 pandemic. This framework provides clear principles to ensure we provide high-quality, person-centred care and rehabilitation in different settings. And finally, to an important new update for today. COVID has caused a great deal of global and UK collaboration across the broad scientific community. The Scottish Intercollegiate Guidelines Network, basically our guidelines factory in Scotland, a part of Healthcare Improvement Scotland, has been working with NICE, the guideline factory in England and Wales, and the Royal College of GPs, in developing a unique collaborative clinical guideline on the persistent effects of COVID-19. This guideline is published today and confirms a formal definition of ongoing symptomatic COVID-19 and post-COVID syndrome, how to identify those ongoing symptoms for clinical teams, and a definition of best practice investigation and treatment options to support the management of post-COVID-19 syndrome. We're actively working with clinical communities and patients and families across Scotland to understand how this guideline can support the care of people with long COVID and be developed as time passes with new evidence. This guideline, together with our deeper understanding of the symptoms and impact of post-COVID syndrome, will help us continue to tailor the care we provide to support patients' needs. Thank you, Cabinet Secretary.
Thank you very much. Let's turn now to the journalists who've joined us today, and first is Gordon Cree from Scottish Television.
Thank you. Health Secretary, we've seen in Wales and Northern Ireland plans announced for post-Christmas full lockdowns being described as like the ones that we had in March. And one of the things they're citing as a reason behind that is the pressure on hospitals and occupancy in hospitals. I just wonder if you could give us a bit of insight onto what the picture in Scotland's hospitals is at the moment, particularly when the COVID numbers in hospital appear to be relatively stable, and whether there's any prospect of Scotland, who's avoided it so far, having to go back into a full lockdown. And if I can ask Professor Leitch, we've seen today East Lothian moving up into level 3. I know you look at the data very closely, and one of the things that's striking in that area is that some parts of the council area have higher rates of COVID, the ones nearer Edinburgh, whereas a bit further along the coast there are areas that it's so low that it's regarded as suppressed. So why do you think it is? What are the factors behind such huge variances within one council area?
Thank you very much. Thanks for that, Gordon. I'll say a little bit about the situation here, and obviously Jason will answer the specific question you've asked him, but I may also want to say a bit more about the situation in our hospitals and in the NHS. Obviously, all of us across the 4 nations of the UK continue to take what we want to be the right decisions. We work very hard to make sure they are the right decisions for our particular circumstances. That's been the case throughout. And undoubtedly, the situation in Northern Ireland and Wales is significantly more challenging than the one we face right now. But that shouldn't mean that we are complacent about the situation we face right now. We know how quickly this virus can take off and spread. That's partly what lies behind all the advice that we give, the repetition that we give every day just about from this podium about the importance of abiding by the measures that are in place and following the facts guidance. So we're certainly not complacent, but it is a situation here in Scotland that we look at all the time. And that's one of the reasons why, as we look ahead to Christmas and we look ahead to what we know are the normal winter additional pressures on our health service and how COVID may play into all of that, we continue to review what are the next steps that we think we should take. And that's why we're undertaking that as we speak. The normal weekly review is underway, and we will, as a Cabinet, discuss that on Tuesday and make that announcement on Tuesday. And nothing at this point can sensibly be ruled out. But we will look at what the information we have tells us, the judgments that we think are the right judgments to make, and we'll make that clear on Tuesday when the First Minister speaks in the Scottish Parliament. Jason.
Thanks, Gordon. So I can tell you that the hospitals in Scotland are coping. They are not ringing alarm bells to tell us to do something dramatic quickly, but it is winter, and it is our first COVID winter, and it is therefore very fragile. You can see as Lanarkshire and Glasgow's numbers have fallen as a result of what the population have done during their level 4 restrictions, that pressure then begins to be eased. It takes a little while for that to play out in hospital admissions and ICU admissions, but you can already see the effects that the population's behaviours have had. In contrast, as Lothian's numbers rise, pressure increases on Lothian's hospitals, inevitably. Borders Hospital, pressure. So you can see as things develop exactly how that works, but it takes 4 to 6 weeks for that to show through in the numbers. So no emergency alerts, nobody phoning me to tell me they need something done dramatically, but we monitor it very, very carefully. I do also speak to colleagues around the UK, and that wouldn't be the picture in Wales and Northern Ireland just now. They are worried, particularly in Northern Ireland. You can hear in some of the language, both from the politicians and the clinical advisors, quite how worried they are. To your second question about local authorities, it is a tricky situation to decide at what level you make the choice. So initially we did it countrywide, and now we have moved to local authority. 32 of them, relatively artificially divided, of course. That's the nature of local authority and regions, and that's where the decision makers have chosen to make the cut. And East Lothian is a good example to your point, because much of the positive cases are on the border with Edinburgh City, and as you move further east, the cases reduce. That is, of course, to do with mixing around local authorities, to do with travel, it's to do with commuting, it's to do with where people shop, where people go for childcare, where people go for hospitality. But unless you go down to a minute level where we wouldn't be able to manage, I think we have to make that choice somewhere. You can see us make nuanced decisions around islands within local authorities. I think to go further down again would just give us more trouble than we would know how to manage.
Thanks, Jason. And just before we move to our next journalist, can I just make a couple of points on the NHS in addition to what Jason has said? I have a daily sit rep that I get from our Chief Executive of the Health Service in Scotland, which tells me how our hospitals are doing and whether or not any of them are anticipating that alert level that Jason has described. So we look at this every single day. But there is, of course, as I'm sure you all understand, there is a trade-off in this. We are trying at the minute to remobilise our NHS for non-COVID healthcare. Very, very important, and particularly important, of course, to those patients who need that health care. During the early stages of the pandemic, we retained emergency, urgent and cancer care and trauma, and that carries on. But we didn't deliver non-COVID healthcare to the degree to which we would want to. We're trying to do that now, but there is a trade-off. The more we have to deal with COVID care through patient admissions and ICU, because prevalence is not being suppressed, then there has to be a trade-off to that, which means that there is less non-COVID healthcare that we can deliver. And we see that in some of our boards. They have the flexibility and the expertise to make those decisions, quite rightly, but all of us need to be conscious of the impact of any increase in COVID cases on what their health service can actually do in care for patients who don't have COVID and who, of course, are really important to us, and we want to be able to deliver that health care. Let's go now to Katrina Renton from the BBC. Katrina. I'm not hearing you, Katrina. I'm afraid I'm still not hearing you. I'm not sure what the problem might be. Katrina, can I just go to Fraser Knight and I'll come back to you, and hopefully we'll be able to hear you then. Let's go to Fraser Knight from Global.
Thank you, Health Secretary. You said there that nothing can be ruled out at the moment in terms of, what the next steps are. We have been speaking to a business owner in Musselburgh, obviously in East Lothian, where they're moving into level 3. He said that he owns a restaurant, and he said that when restrictions were first eased, they took on new members of staff. And now they find themselves in a position where they don't know whether they're going to be able to get through the rest of level 3, and they don't know whether they'll be able to keep the staff on. Can you give us an idea of how actively the government is considering a potential full lockdown after Christmas? You said nothing can be ruled out, but how actively are you considering it?
So the first thing I'd want to say is I completely understand, as best I can, the difficulties that any small business or large business, for that matter, is facing throughout this year from the start of the pandemic. It can't be at all an easy situation for business owners, and certainly not for the staff that they employ. What we have to all understand, and I'm sure they do, is that the more we can successfully suppress this virus, the better chance we have of economic recovery and economic health. And if we are not successful in suppressing the virus, that is very damaging indeed to economies, whether they're small businesses or large businesses. And as you know, we're trying to do everything we can to help those businesses get through this really difficult period. On your other question, Fraser, we are doing what we do every single week. We look at data every day about case rates per 100,000 across our local authority areas, how our NHS is coping, where the pressure points are, how we anticipate the virus progressing in any areas as best we can, bearing in mind that the data we look at, of course, in terms of hospitals and so on, we're looking at a time lag when we see people being admitted to hospitals. We do that every day, and we look at that in the round over a 7-day average every week. And we then try to make the best decisions we can, the judgment that we can best make about what we think we need to do to continue to pursue our overall aim, which is to suppress the virus to the lowest possible level. Now, we all know, and you know, I'm sure very well now from watching these briefings and from, as a journalist, looking at all of this in detail, how the data moves. So it isn't sensible on a Friday for me to say what I think is going to be the decisions that we reach as a cabinet next Tuesday. All of that emerging thinking, emerging information, intelligence and data is considered as we go, and then we reach the judgments that we are best able to make, intending always to make the best possible decisions based too on the clinical advice we get from Professor Leitch, from our CMO, our Chief Nursing Officer, our National Incident Management team as well, and we make those decisions and announce them on the Tuesday. And that is the situation. I completely appreciate everyone would love to know today what next week is going to be like. It's not possible in the way that this virus operates, and the importance of us looking really closely and carefully at the information we have, and then wanting to use that to reach the best judgments we can make for us to be able to do that. So at this point, what I said earlier stands. We look at this, as I've just described. We're not the least bit complacent about Scotland's position now relative to the other nations of the UK, and sensibly, every possible option remains on the table. That doesn't, nobody should take that as one option being the one we're going for or another. Simply a statement of fact. Every option remains on the table. Let's go back and see if we can get Katrina now.
Good afternoon, Health Secretary. Thank you very much for bearing with me at this end. I've had some technical problems. I think what we would like to ask about this afternoon is the long COVID guidelines that are published today recommend a joined-up approach to assessment and treatment to avoid disjointed care that some patients have experienced. Given that are you inclined, given that, to set up long COVID clinics? And if not, why not? And if I may, just on the issue of Wales and Northern Ireland, is there any advice you can give businesses looking into the new year?
So just on your last question, Katrina, I really don't think I can sensibly say anything more than I've already said on this. We always try to give businesses and the public as much notice as we can, but it really doesn't make sense on a Friday for me to say what I anticipate is going to be the position come next Tuesday. We need to do it properly. That's what people across Scotland would expect us to do. These are difficult judgments. We've talked about this before. They're not easy to make, but you need to make them on the basis of the best information, advice that you can harness, and that needs to be as up-to-date as it possibly can be before you reach those judgments, knowing all the time, as we do, of the very real impact they have on people's lives and their livelihoods. So I really won't say any more than I've already said so far. I'm going to ask Jason to say a little bit more about long COVID and how we think that may play out. Whether or not we end up delivering those holistic, multidisciplinary-based services in a clinic, or whether we maximise the use of our excellent primary care system in Scotland and the relationship patients have with GPs, is not yet finally decided. But we shouldn't discount the importance of primary care across Scotland and the importance that for most of us, our principal relationship with the NHS will be through our GP practice, the practice nurse, the GPs themselves, the other disciplines that are there ready to help us. So we'll look at that as we go in discussion with all those other individuals, and importantly hearing from people who are currently suffering from long COVID. But I think we should remember the importance of primary care in our health service in Scotland. Jason.
I think it's a good question, because quite a lot of the world globally is thinking, let's set up long COVID clinics. I think we should think of it as long COVID services rather than long COVID specific doors with that name on the door. And that's how we treat pretty much every condition in the National Health Service. If you have epilepsy or diabetes or asthma, there is a pyramid structure of where you will get treatment for that. The vast majority of asthmatics never go to a respiratory clinic. They are seen in their general practice, they have repeat prescriptions, they are managed very well by community nurses or whatever that pyramid might look like. And then a very small number of asthmatics have to go for regular respiratory clinic visits to see a consultant and a secondary care team in a hospital. I think in time long COVID will look much like that. Many people will have longer symptomatic spells and then it will go away again. That will be managed in primary care. And some will have, I'm sure, long, stubborn, debilitating disease, which is what we're seeing in a very small number of people, and they will perhaps need a more specialist centre. And that will be rehabilitation, it may be respiratory, it may be cardiac, It will depend on their particular symptoms. So I don't envisage a new sign in the hospitals saying long COVID clinics this way. I think it will be much more holistic than that.
Thanks very much. Bruce Mackenzie now from ITV Border.
Health Secretary, throughout this pandemic, we've seen a lot of local authorities asking to go down in levels. But yesterday in the Scottish Borders, we saw authorities going the other way and making a plea really to see their level of restrictions raised. Perhaps even, it would appear by the numbers and the way they're growing there, as high as level 3. I know you've said on a number of occasions today that these decisions are not taken until Tuesday, but is there an argument there for a decision about the Scottish Borders sooner than Tuesday? And if I could, for Professor Leitch, I've been hearing from a lot of parents in recent days about their concerns about preschool age children who are struggling to socialise. Obviously, the weather has been fairly terrible over the last week, so they can't do a lot of that outside. A place they might do that would be soft play centres. Where we are in Dumfries and Galloway in level 1, soft play centres are still shut, but people can go to a pub. I wonder if there's any chance that restrictions might be eased around soft plays as we head into the worst of the winter weather.
Thanks very much, Bruce. I am aware of the views that have been expressed today by Scottish Borders Council and by our colleagues in NHS Borders. I heard the leader of the local authority this morning on the radio, and I heard her express those concerns. Part of the process that I described earlier includes talking to local authorities, the chief executives and the council leaders, and of course our local directors of public health are engaged in conversations with those local authorities around the specific data for each local authority as it moves over the 7 days period that we're looking at. So at this point, we will be in those discussions, I'm sure, with Scottish Borders, either having them or planning them over the next day or so, and we'll hear what they have to say. But at this stage, the clinical advice that I am receiving is not that we need to act sooner, but that we do, with Scottish Borders, as with all the local authorities, need to pay close attention to what the information and data is telling us, and to what those local authority leaders have to say as well, so that we reach as close as we can, a shared view by the early part of next week about what the right next steps are for any specific local authority. Jason, do you want to pick up on the...
So Scottish Borders is unfortunately a neat case study in the challenges of this virus. They've gone from 37 per 100,000 to 95 per 100,000 in 10 days. And we made a decision to bring them down because it had been stable for so long. It illustrates the fact that it is slow to go down, but very fast to go up. And it is one of the great challenges in managing at a population level this viral agent, I'm afraid. Their test positivity has gone from 2.6 10 days ago to 4.8 on the 14th. So we are watching them. There is a call this afternoon. My deputy is speaking to the National Health Service and the local authority this afternoon. I've spoken to the Chief Executive of the Health Service there 3 times in the last 3 days, particularly around capacity in the hospitals. So we are watching them very, very carefully. And our advice will be formed from that local information up to the National Incident Management Team and then into that Cabinet conversation the Cabinet Secretary describes. But you can be absolutely certain that we're watching them carefully. To your soft play point, I'm afraid I've answered it many times, and I don't have anything good to offer them. I know it's really difficult, and I feel really bad for them. I have actually personal friends who own soft play, and it's really, really difficult. We look at each of these cases on their own, but then we also have to look in the round at everything. How much is open, and how much can you allow to be open in order to keep those numbers down, as we've just illustrated in Borders. And Dumfries and Galloway is in level 1. It is holding it there. It's doing really well, and we're scared to open more things. It is the blunt truth. And soft play is one of those areas where we're very, very concerned. And we've been to see, we've sent people to see, and they're doing well. Their mitigations are as good as they can be, but just the nature of what the offering makes it just too dangerous for now.
Thanks very much. Conor Matchett from The Scotsman.
Thank you, Health Secretary. As of December 12th, I think it's just about or just under 44,000 lateral flow tests have been done at university and college sites for students planning on going home at Christmas. That's about a maximum of 22,000 students who've taken the recommended 2 tests before going home. Can I ask if you've got an update on that figure? Obviously, tests will have taken place this week. And given the hope from Alistair Sim, the Director of University of Scotland, that 65 students would take part, do you believe that the testing rollout can be considered a success? And just going back to the questions about, post-Christmas restrictions, can I ask the both of you whether or not you believe a post-Christmas lockdown would be likely, if not inevitable?
Thanks very much, Conor. And on your second question, I suppose it's always worth a try. Neither Jason or I are going to say anything more than what I've already said about this, and I know you will have paid careful attention to that. On the question about student testing, clearly a really important exercise. I know that our colleagues in the testing side of Scottish Government and the NHS and our colleagues in universities across the country have worked really hard, not only to make that testing available, but to encourage students to take it up. And whilst I don't have more up-to-date numbers with me than you've given us this morning, if there are more up-to-date numbers, then we'll make sure that you get that later on today. I think it has worked. Of course, it's voluntary, as is all asymptomatic testing. We can't make people do this, but I know that the National Union of Students was very encouraging of its members, so it is very important, and that it will be part of the return following the festive period. So those students who have taken up that opportunity, I think it will have given them a degree of reassurance as they look to return home to their family home after Christmas. They will know that they still need to take the real precautions in terms of the public health guidance that I set out at the start of this briefing and that we set out every day, that applies to all of us, whether or not we've had an asymptomatic test and it's come back negative. So we will want to continue to do that, because from those tests, we will have been able to give students and their families a degree of reassurance, and where a student has tested positive, then we will have been able to act to support them through the period that they need to isolate in order to make sure that any positivity that they have about the virus passes before they go back to those they love. Jason, I don't know if you want to add anything to that.
I was going to add, we don't only learn from positives, we also learn from the negatives. And I think it's very welcome that the student population has embraced this, and many of them now have more reassurance than they had when they go home and to be safe. It's not foolproof. We've been over that many times from this podium. It's not completely foolproof, but it is another layer of protection for the student body and their families and loved ones.
Thanks very much. And now Dan Vevers from The Sun. I hope I've got your surname right there, Dan.
Yes, you have. Good afternoon to you both. Kate Forbes said last week that 330 million of the Barnett consequentials the Scottish Government has received for COVID is being held back for contingencies, potentially non-COVID related contingencies like Brexit. How does that square with the repeated pledges of ministers to spend every penny of this cash on tackling the pandemic? And we've been told of cases at different schools where parents have had to raise money to, for example, buy hand sanitizer for pupils or for the construction of outdoor shelters. So what message is holding back this cash sent to them and other struggling public services? And secondly, journalists here have already mentioned talk of a possible post-Christmas lockdown. Don't worry, I'm not going to ask you if it's going to happen or not. But we have seen on many occasions this year that lockdowns do have limits, both in terms of their effectiveness and serious downsides. Were we meant to be avoiding constant cycles of lockdown by virtue of a good test and protect system? And are you gathering any strategic thinkers who could perhaps carve out a new way, maybe where we have more constant, moderate restrictions rather than all the chopping and changing? Thank you.
Thanks very much for that, Dan. I'm going to hand over to Jason on the question of effectiveness of lockdowns. The only thing I would say is I don't think that we've been engaged in a cycle of constantly chopping and changing. I think we've set out really clearly our overall aim, actually an aim that the data and the report show us we achieved in the summer of suppressing the virus to the lowest possible level. And we take the decisions and set out our rationale for those decisions to take us really every step as close to that as we possibly can. The virus is, it's not unpredictable. We can predict, we know what it does, and that is the more of us who have contact with each other, the more chances it has to transmit itself from one person to another. Now, you need to balance banning contact, if you like, making sure that that isn't practical or feasible for people, with the consequences of that on how people live their lives in practical terms, but also in terms of our mental health and the isolation and loneliness that people can suffer. And that balancing that is a constant about what we have to do is never straightforward or easy, and there's no binary way of doing this. You have to make those judgments as you go. But it isn't constant chopping and changing. It's setting out clearly where we think we are, what we think we need to do, implementing that, and then moving to the next series of steps. On the question about the 330 million, it isn't a contradiction with what Ms Forbes said. Every penny that is identifiable as additional COVID consequentials and where it should go, how it is connected to another area of necessary spend has been allocated. But 330 million, Ms Forbes made the point that it may be necessary to use that for Brexit. If we think that cashing out of the European Union with no deal at all, or some kind of resolution at the last minute, will not have an impact on how we can respond to the COVID pandemic, then I think we're really missing something really quite fundamental and important. And the final point on that I'd want to make is that the decisions about how contingency is used will be set out in the Scottish Budget. And as you know, that is planned for, I think, the third week in January, certainly in that month. And that will set out the decisions that we've made about how all of those funds have been used. You will see that every penny of COVID consequential money has gone to our response to that. And in addition, as a government, we have spent more than the consequential money, the additional money we've received from Westminster in some areas. I know how that works out and plays out in health. But on the question about lockdowns, Jason, do you want to respond?
Thanks, Dan. I was also going to say, I think chopping and changing is a little harsh, but what we've tried to do is find a balanced road from extreme lockdown, 23rd of March version of lockdown, with allowing society, loneliness, mental illness, business and economy to open to some extent. You can see every country in the world struggling with that. Some have managed to have very severe lockdown for a number of weeks or months, and because of their geography and their position in the world, the Faroe Islands, New Zealand, you could argue Australia, you could argue actually the Isle of Wight or the Isle of Man, have managed to restrict entry and exit, and therefore once they get down, they've managed to stay down. Much harder for mainland and island European countries like ours or France or Germany to get that. And you can see even in Germany, the poster child of wave one, now really struggling and having a Christmas and New Year lockdown coming up because the virus has come back and it's beginning to rise. So we do have pretty much every thinker you can think of helping us. Even if you don't think the internal government thinkers are innovative enough, our advisory board has Stephen Riker, the behavioural science expert. It has Devi Sridhar, one of the global public health thinkers, and a host of others to help us make these really, really difficult choices in the advice that we then give up the chain to the Cabinet Secretary and to others. If people knew how to do this, then we would embrace it. But Canada, America, Germany, everywhere is struggling to find a path through this pandemic. And I think we're doing well, but there's always more to learn.
Thanks very much. Simon Johnson from The Telegraph.
Good afternoon. I'm not going to ask you again if there's going to be another lockdown, but I just wondered if you have any forecasts, any estimates for the extent to which the number of COVID cases could go up as a result of the easing of Christmas restrictions? Or is it a case that basically we're just crossing our fingers and hoping for the best? Secondly, I was wondering what your advice would be to people who want to hit the Boxing Day sales this year. Obviously, we're used to scenes of people queuing from midnight to try and beat the competition to a bargain. Thank you. Thanks
very much, Simon. I don't think it's, we're certainly not crossing our fingers and hoping for the best. I don't think we've displayed that at any point during the pandemic. It is difficult to model ahead around the easing over those 5 days at Christmas. Our advice is really clear. It is a window of flexibility, but if you don't have to take it, please don't. And if you do, then please for 1 day only and no overnight stays and all the other things I said at the outset. But we have to allow people to make those decisions and choices for themselves. And I think it is pretty clear over the past 11 months or so that the vast majority of people in Scotland completely understand what needs to be done and comply with that and make every effort and huge sacrifices to be able to do so. So we will continue our forward modelling, but it is exactly that. It is mathematical modelling, and it needs to be informed by real life and the intelligence that we get back and the information we get back around compliance. So that is the work that is in hand. On the Boxing Day sales question, and Jason may want to say a bit more of that, given considerably more, in fact, completely more clinical experience in this area than I have. On the Boxing Day sales, the simple thing I'd say is avoid crowded places. You know, we keep saying that. The Boxing Day sales are notoriously crowded places. Please avoid crowded places. There can be nothing in those sales that is worth that risk. So please don't take it. Jason.
Yeah, so on the second question, I completely agree. I had written down online and underlined it 3 times. So that may not be popular with retailers, and I'm deeply sorry, but it is risky to go to the crowds. So please try and avoid that. On Boxing Day or tomorrow, avoid it at any time, particularly when you know it's going to be busy. And if it's busy, leave. I think the plans, the data for Christmas are somewhere between hoping for the best and the precise modelling that you and we seek, Simon, to be honest. It's so difficult to know how many people will choose to use the reduction in restrictions and how much they will do it by, and then how safe they will stay inside that reduction. It's hugely difficult to model. The modelers, we know that if you mix, you increase risk. If you mix in high prevalence areas, you risk more. So if you mix in Orkney just with Orcadians, that's going to be lower risk. But if a whole load of people come from a high-risk area, be it Scottish, English or French, that's going to increase the risk in Orkney. And that's what worries us. And that's the really, really difficult thing to model, I'm afraid, to give us any accurate. But you can tell from our body language and our communication that Christmas is going to increase the prevalence of the virus. That's what we're worried about.
Thanks very much. Rachel Watson from Daily Mail.
Thank you. I just wanted to ask, I know you go back to the post-Christmas lockdown, and I know that you're not going to say either way what's actually happening, but can you shed a bit of light on when people might expect to find that out? Will you tell people next week your thoughts on a post-Christmas lockdown before the relaxation of rules, or will it be the case that the government will wait and see what happens and wait to see that impact, how cases rise across the country before making any decision?
We'll go through the process I've described in great detail and Jason has added to earlier, that we go through every single week. And the additional element, of course, this time round is, as Jason has said and as we've said from the outset, we have anxiety around the easing of restrictions over that 5-day period at Christmas. That's why we've added the additional elements of advice that we have added. We're trying to balance the pragmatic approach and the, if you like, the compassionate approach, knowing that for some of our citizens, loneliness and isolation is a really serious issue, and we want people to have an opportunity for that to be lessened for a limited amount of time. That's why we're talking about the 5 days. Please use 1 day as a window of flexibility. And as Jason said, if you do use that, use it safely with all the other guidance that we put around that. So we have all of that in the mix. And we also always want to give people as much rationale for our judgments and decisions as we possibly can, and as much notice as we possibly can. So when we get to making those decisions as a cabinet on Tuesday, we will be looking at all of that. I'm not going to say more than that, because to say more than what I've said, I'm not trying to avoid answering any of these questions. What I'm trying to do is just be really straight with you that on a Friday, it does not make sense, knowing what we know, what you know about this virus, how it moves. Borders is a really good example for us. It doesn't make sense on a Friday to say what is going to be the decisions and the judgments on a Tuesday. What is the right thing to do is to remind us all of the process that we go through, the really serious, hard attempts we make to gather all the intelligence, listen to local authorities, gather the data, get the advice from national IMT, then from our clinical advisors like Jason and Dr. Smith, and then as a cabinet make those judgments and those decisions about what we think is right. And we will do that and set that out on Tuesday for the period as far ahead as we think it is sensible for us to do. Jason, is there anything? No. Thanks very much then. Mark McLaughlin from The Times.
Good afternoon. I've got quite a technical question for Jason Leitch, so bear with me. I've been contacted by a lot of teachers who are hopefully misguidedly incredulous at the teacher report, which showed that teachers have a statistically higher chance of being diagnosed with coronavirus, but this was due to something called ascertainment bias, which means you test more teachers, you get more positives. So how can we have ascertainment bias in the teaching population? But then we are also told that the reason that we know that coronavirus is actually rising is because of the percentage positive. So how do we know that the rise that we're seeing in general society is not to do with the rise in testing in the same way as the rise that you saw in teachers? And can you just explain in kind of layman's terms what ascertainment bias is?
It simply means if you go looking for it, you get more numbers. And that is true in the general numbers. So if we go to Clackmannanshire and set up an asymptomatic testing regime, you will almost certainly find more virus. And we choose to do that in areas of high prevalence. What the report suggests is that the fundamental risk of being a teacher is no different from the fundamental risk of being a civil servant. That doesn't mean that some teachers don't get the disease and some civil servants don't get the disease. So I don't want to underplay the nature of the disease or the risk of transmission, particularly amongst adults in schools. And that's why my wife and other teachers around the country have done so well in order to manage the education service in the way they've managed to do it. We don't look, remember, at just raw positivity data. It by itself would do exactly as you describe. It could potentially move according to where you put your testing or what you particularly look for. We also look at simply the number of tests done in relation to the positives and the nature of that testing around the country. So inside that are judgments. It's not just that the number rises. But as you get a stable type of testing, that's not what you would call it technically, I don't suppose, but as you get stable testing around the country and your positivity goes from 2% to 4%, that does tell you something about the pandemic. And the WHO tell us, not in isolation, but they tell us to look deeply at the positivity rate in relation to that stability across your country. And the Borders is, I'm sorry to point to them again, it's just the one I have open in front of me. The Borders, roughly speaking, the same number of tests that they're doing across their region, and it's gone from 2.6 to 4.8. So we know something is happening there that isn't to do with ascertainment bias.
Thanks very much. Alistair Grant from the Herald.
Hi there, thanks very much. Are there any figures around how many people in Scotland have reported having long COVID? Or any kind of details on the age categories and characteristics of those affected in Scotland? And could I also ask as well, would you advise people to wear face masks indoors if they plan to see other households at Christmas, as the World Health Organization appears to be recommending? And just finally as well, if you're effectively telling people to avoid Boxing Day sales, is it not better just to go into lockdown and give shops extra financial support to stay shut, rather than allowing them to open, but effectively telling people to stay away, ensuring they will lose money?
I'm going to ask Jason to pick up on the long COVID question. I'm not sure if we actually have robust numbers around that, but if we did, we would certainly make sure that we get them to you. And if we don't have robust numbers, we'll make sure you know that as well. But I'll let Jason say a bit more on that. On the Boxing Day sales question, Alistair, well done. You've come at this question from a completely different angle, and I'm still going to say what I said earlier on, not because I'm trying to avoid this, but for all the reasons I've set out. The straightforward answer is any shop that is crowded, don't go. And if you do go and you find it is crowded, please don't go in, leave. That's not new advice. That's been our advice for some weeks now. It's about avoiding crowded places, because where there are crowded places, then that's where the virus has yet another excellent chance to move from one person to another. And that's what we are all trying to avoid. So Boxing Day sales, any other kind of sales, a supermarket that is too crowded as far as you're concerned, then don't go in. Go back at another time if you possibly can. And if you can, then yes, as Jason has said, online shopping, it's hard for our high street retailers, I know, to hear that, but it is a way by which people can get the goods that they are after, including essential goods, without taking any of those other risks that we've described. But on the point about long COVID and face coverings, I'm going to let Jason deal with those.
In common with the rest of the world, we don't have accurate numbers for post-COVID syndrome or long COVID. Step one in the UK is to define it, which is what's happened today. So that guideline begins to set us on that path where we will now be able to diagnose it in our clinical communities, and then we'll be able to start to count it. And that counting will help us know the prevalence, but will also help us with designing what treatment, what clinics, what services will be required. But we do not know how many people it affects, and we don't know the nature of what those people are like. Do they have pre-existing conditions? Is it more women than men? Is it 40-year-olds and not 20-year-olds? So that will become apparent globally over the next few weeks and months. The WHO advice is good. It came out because the WHO are worried about Christmas, of course, around the world, not just Scottish Christmas. And what they suggest is very sensible. It says if you are indoors with people who are not in your household, you should think about wearing a face covering. That's true in workplaces in Scotland just now. That should also be true when you have your Christmas celebration, if you can possibly do it.
Thanks very much. And our last journalist today is Adele Merson from the Evening Express.
Thank you, Health Secretary. NHS health chiefs have warned that coronavirus is circulating widely in the North East, with almost half of cases not linked to known outbreaks. They have said it is eminently probable that this could mean a swift move from level 3 into level 4. Do you agree that this is likely, and what advice would you offer residents in the region as the Christmas period approaches?
So thanks very much, Adele. There's two things I'd say in response to that, and Jason may want to say more. The first thing I'd say in terms of advice to residents is please follow the restrictions in the area at level 3. Please make every effort you can to follow those, and please make every effort you can to not just know the facts guidance, but to practice it. Because face coverings, washing our hands, cleaning hard surfaces, avoiding crowded places, all of that makes a real difference. It's all about the steps that we can take individually and together to prevent this virus going from one person to another, which is what it wants to do. And when we talk about reducing the virus and then it comes back. The fact of the matter is it never went away. We reduce it by our actions and it comes back when we ease up on those. So practice all of the guidance that you know so well, you've been doing up till now, and keep on doing that, including thinking really carefully about your plans for Christmas. And if you can have this Christmas this year without seeing other members of your family outside your own household or friends or loved ones, then please do that, because that is the safest way to have Christmas. In terms of what is being said about the rise in case numbers, then the data is there for us all to see. We've moved those areas, as you know, now to level 3 in response to that. We continue, though, we don't move a local authority area to level 3 or even down to level 2 or 1 without continuing to look and see what is happening, and without making Scottish Borders feel that they're particularly picked on today, but they are a good example, again, of continuing to look at what is actually happening and being prepared, if we need to make those kind of decisions down or up in terms of the levels, all designed to help us suppress the virus to the lowest possible level, because that way we are keeping ourselves and our loved ones safe, but we are actually also saving lives. And there can be nothing more important than that. Jason, do you want to add anything to that?
So Grampian is worrying. It has been worrying for some weeks. It's a slightly different story in the 3 local authorities, of course. Murray, very low levels, but even in Murray, the numbers are rising slightly. Aberdeen City is this week's big concern. It's gone above the Scottish average now. The latest number I have here is 140 per 100,000, up from 73 10 days ago. And Aberdeenshire, stable but slightly risen from 84 through 72 up to 90. Grampian illustrates once again the nature of getting this virus down being so hard and rising being so easy, which is why you have to act fast and hard before the numbers move in order to save those lives, which the Cabinet Secretary describes. My advice to people in Grampian is the same as my advice to people around the rest of Scotland. Do not go to the edge of the guidance. Just because you're in level 2 or level 3 doesn't mean you should push to the edge of that guidance and do what it allows. You should think very carefully about staying within the guidance by quite a margin. That will reduce the prevalence in the country, and then we will be able to move the country down, and we will get the prevalence down, we will save lives, and people can get their lives back to normal.
Thanks very much. That concludes our questions for today and almost concludes the briefing. Before I do, can I thank Rachel, who's our BSL interpreter for today. Can I thank Jason for joining me and the journalists for joining us too. And most of all, can I thank all of you for taking the time to spend with us again today. You know, I know this is not easy. I know it is tough and at times remarkably wearisome, but it is really important. And what you are doing every single day, complying with the guidance, following the facts outline and wearing those face coverings and washing your hands, cleaning hard surfaces, avoiding crowded places, staying 2 meters apart, all of it is making a difference. And I am eternally grateful to you for doing it. It doesn't get easier, but it is really important that we all stick with it. So to all of you, thank you so much for doing that. I hope you have a reasonably good weekend, and we'll see you at the start of next week. Thanks very much.